Today we will talk about a few common elements with which parents and children visit pediatric office for a pediatrician consultation. Nose bleeding is one of the common element which we see in pediatric office practice. Nose bleeding is common in all age groups of children and it is very common in hot and dry weather. And the second commonest cause is nose picking in children. So what could you do as a first aid? How could you help a child when there is nose bleeding? First of all, relax and stay calm yourself, as well as reassure the child that you can help with his nose bleeding. The parents, teachers, or the attending adults can make the child sit with his head bending little forward. The child should not tilt his head backward because that may result in blood trickling down his throat and that may induce gag reflex. So when the child is sitting like this, or when the younger child is not able to sit by himself, the adult can take him in his lap and make the child sit with his head bending little forward. After that, with the two fingers, maintain a good pressure, pinching the nose just in front of the bony part of the nose. And during this time, the child should relax and breathe through his mouth. Pinching of the nose should continue for 5 to 10 minutes. After the 10 minutes, release the pinching and see if there is a persistent bleeding. If there is no bleeding, then the child can continue with his routine play, but make sure that he is doing a relaxed play and nothing very hard play, as well as he should not do any nose picking or nose blowing because the clot may get dislodged and the bleeding may renew itself. If there is a renew of the bleeding even after the pinching of the nose, we can do a second attempt of nose pinching for 10 minutes the similar way and reassess. But you should visit a hospital emergency if the nose bleeding is continuing in spite of the first aid given. If the child is feeling very weak or dizzy during or immediately after the nose bleeding is stopped, or if the nose bleeding is as a result of a head injury or a blow to a child's head or the nose. If there is a stoppage of the bleeding, but if it is coming again and again, recurrent bleeding, even then you should consult a doctor. Or if you think the child would have put anything inside his nostril like a foreign body, or if the child has got any injury, even then a visit to a doctor is important. Also ensure that if there is any bleeding from any other part other than the nose, which could be result of a general bleeding tendency rather than only the nose bleeding. In that case, the pediatrician may help you finding out the reason for it. Another thing is, how can you prevent this kind of nosebleeds? First, avoid nose picking, trim child's nails regularly, keep the nostrils moist with the help of the saline nasal drops and some emollients onto the skin of the anterior nares. Thank you.